In Rapid Recovery from Back and Neck Pain, I revealed pain facts most patients are not told. In this video, you will discover important facts about the diagnosis and treatment of type 2 diabetes that most doctors, with good intentions but due to busy schedules and other reasons, do not tell their patients, including a very key fact that a world-renowned expert from the prestigious Mayo Clinic says that most doctors are not aware of. So let's begin with the first fact most doctors do not tell their patients. According to Dr. H. Gilbert Welch, who has served as a professor of medicine at Dartmouth and author of several books helping patients, including Overdiagnosed, Making People Sick in the Pursuit of Health. In 1997, the Expert Committee on the Diagnosis and Classification of Diabetes mellitus redefined this disorder. The committee decided that if you have fasting blood sugar of 126 or over, you have diabetes. Now, prior to 1997, let's say 1996, if your blood sugar was 140 or more, you were diagnosed with type 2 diabetes. That little change turned over 1.6 million people into patients. About this, Dr. Hadler, Emeritus Professor of Medicine at University of North Carolina, Chapel Hill, and an author of more than 200 medical papers and several books helping patients, including Worried Sick, A Prescription for Health in an Overtreated America, wrote, "If we keep lowering the cutoff, pretty soon all of us will age into type 2 diabetes." But why the change from 140 to 126? According to Dr. Hadler, the members of the panels often have financial ties to the marketplace one way or another. So it's for financial reasons that rules are changed by these panels so that more and more people are diagnosed with type 2 diabetes, also with hypertension and with high cholesterol level, so that normal healthy people as well as those with minor abnormalities are turned into patients and put on medications that brings huge profits to drug companies. Now, the second fact that most doctors do not tell their patients is that according to Dr. Welch, even though there are severe complications associated with type 2 diabetes, including blindness, kidney failure, heart disease, impaired healing of wounds, and leg infections requiring amputation, there is a spectrum of abnormality in diabetes. Some people with diagnosis will develop the aforementioned complications and others will not. So that's another fact that a lot of doctors don't tell their patients, that even though you may have high blood sugar, it doesn't necessarily mean you will develop those complications, especially if you're an older person. According to Dr. Hadler, normal blood sugar is age dependent. As glucose levels go up, risk of death increases only very gradually among older people. People can run higher than normal blood sugars and still be well. High blood sugar will cause damage over time, but older people have less time left for those complications to happen. Endocrinologist and geriatrician Dr. Mehda Munshi is an associate professor of medicine at Harvard Medical School, specializing in treating diabetes in the elderly, and she agrees. She wrote in a post for the Harvard Medical School website titled, "Is tight blood sugar control right for older adults with diabetes?" People in their 80s or 90s may not have several decades of life expectancy, and so the concern about developing long-term complications due to high glucose levels is decreased. Of course, if medications are given and they develop hyperglycemia, that could lead to certain problems. So she continues, however, hyperglycemia in these individuals may lead to immediate consequences such as falls, fractures, loss of independence, and subsequently a decline in quality of life. In fact, the updated guidelines for treating diabetes in adults 65 years and older from medical associations such as the American College of Physicians, the American Geriatric Society, and the Endocrine Society, as well as the American Diabetes Association, underscores this fact. Now, if you are diagnosed with high blood sugar, take it as a warning to make positive changes in your lifestyle, especially in your diet. And we'll talk more about what kind of diet to follow later in this program that's good for reducing your blood sugar. Now, the third fact most doctors do not tell their patients is that the medications and the treatments that the mainstream medicine is offering does nothing to reduce the risk of kidney and eye damage, stroke, heart attack, and peripheral neuropathy. Regarding this, Dr. Hadler, in a commentary he wrote for abcnews.com, says the following. I have practiced medicine for 40 years. I've never prescribed a pill to lower blood sugar. I still see no reason to do so. If I'm disadvantaging my patients, it's to a trivial degree at most. However, I know I'm sparing them known and unknown hazards. So what is one of those known hazards that most doctors do not tell their patients regarding the medications they give to patients with type 2 diabetes? Well, that is the fact number 4 you discover here. You see, studies have shown those on medications to lower blood sugar have a higher risk of death compared to those who were not treated with those medications. Regarding this, Dr. Welch says, you might wonder how making people's blood sugar normal could end up killing them. It's probably because we can't simply dial a patient's blood sugar to a specific number. Our therapies aren't that precise. Instead, blood sugar bounces around, and if we try to have blood sugar bounce around normal, sometimes it will bounce too low, and having your blood sugar too low increases your risk of death. Dr. John Abramson, who serves on the Faculty of Medicine at Harvard Medical School, also reveals the same important fact in his book, Sickening: How Big Pharma Broke American Healthcare and How We Can Repair It. He says that in 1997, the Diabetes Quality Improvement Project, founded by the Center for Medicare and Medicaid Services, the American Diabetes Association, and the National Committee for Quality Assurance, established the first national standards for diabetes care. The Diabetes Quality Improvement Project determined that hemoglobin A1C level of 9.5% or greater is the point at which many people experience diabetic symptoms. As Dr. Abramson explains in details in his book, this determination based on scientific evidence did not sit well with drug companies who preferred an A1C of 7% or lower so that more people would be diagnosed with type 2 diabetes and put on drugs. Dr. Abramson explains in great detail how drug companies began a massive campaign to convince doctors, medical associations, and others that A1C of 7% leads to diabetic symptoms without any scientific evidence at all, and they succeeded in making 7% the standard. As of 2018, 5 large long-term randomized trials had evaluated the benefits of tight glucose control to maintain hemoglobin A1C below 7%. All 5 studies showed that it didn't reduce death, heart attack, stroke, loss of vision, renal disease requiring dialysis, or painful diabetic neuropathy from type 2 diabetes. At the same time, all 5 studies showed that more intensive treatment led to more complications like hypoglycemia and even death in one study. To quote Dr. Hadler again, I have practiced medicine for 40 years. I have never prescribed a pill to lower blood sugar. I still see no reason to do so. If I'm disadvantaging my patients, it's to a trivial degree at most. However, I know I'm sparing them known and unknown hazards. This is a serious matter, and I highly recommend to inform and empower yourself by reading these books, doing your own research, and consulting your doctor. So far, you discovered 2 facts about the diagnosis of type 2 diabetes and 2 facts about the treatment of type 2 diabetes that most doctors do not tell their patients. Now, to solve a problem effectively, you need to know the cause. In case of type 1 diabetes, the cause of high blood sugar is that pancreas is not producing insulin, and by giving insulin to the patient, high blood sugar is resolved. In case of type 2 diabetes, the pancreas is producing insulin, but the cells have become resistant to it and do not allow insulin to take sugar into the cell and out of the bloodstream. So what is the cause of insulin resistance and how can we treat it properly? This is where the role of the liver comes in. According to world-renowned liver expert Dr. Ibrahim Hanoune of the Mayo Clinic and the Cleveland Clinic and co-author of Skinny Liver, when too much fat is in the liver, it becomes harder for the liver to do its job and thus it struggles to control fasting glucose level. The excess glucose causes the pancreas to secrete even more insulin to compensate for the higher levels. This in turn triggers the beginning of insulin resistance and impairment of beta cell function of the pancreas, all of which can lead to the development and or worsening of type 2 diabetes. Dr. Hanoune says most doctors aren't aware of this fact, which we can call important fact number 5 that most doctors do not tell their patients. Perhaps in this case it's because they're not even aware of it. Now, according to Anthony William, author of Medical Medium Liver Rescue, another reason for insulin resistance is the presence of too much fat in the blood due to too much fat in the diet. The fat circulating in the bloodstream makes it difficult for insulin to enter cells and take glucose with it, therefore leading to insulin resistance and type 2 diabetes. So the solution is to restore the liver to good health and reduce fat in the diet. A few months ago, when I learned about the important role of liver when it comes to high blood sugar, I had a fatty liver. So I started to follow the protocol presented in Medical Medium Liver Rescue in order to restore my liver, and within 2 months of following that protocol, these are the improvements I made in my health. Fatty liver cured, lost 12 pounds, lost 6% body fat and lost them right all from my belly, that so much that I could actually see my ab muscles and I hadn't seen those for years. No more waking up at 3:30 a.m. No more night sweats. No more waking up to heart palpitations. I do better with less sleep because now I'm sleeping better, I'm sleeping deeper. Fasting blood sugar dropped by 10 points from 105 to 95 within the first 2 weeks actually. Blood sugar 79 2 hours after drinking a fruit smoothie. Much better digestion, no more constipation, no more bloating even with apples, good lymphatic flow, better brain function and memory. Total cholesterol went from 267 to 157. My LDL dropped from 203 to 101, and my triglycerides went down to 66. I explained in an earlier video, and I provide the link in the description, or you can find it in my YouTube channel, the steps that I took that allowed me to achieve such great results so quickly. Here I'm going to go through it very briefly, so at least you have a sense of what it was, but I highly recommend watching that video so you get a full sense of what it requires to get these great results. So I start my mornings on an empty stomach with 16 ounces of lemon water. You just take a half a lemon, squeeze it in water, and then drink it. And then I wait about 15 to 30 minutes. I had celery juice just by itself that I made fresh in the morning. And then about 15-30 minutes later for breakfast, I ate fruit, either a fruit salad or I had fruit smoothie. I even had like cucumbers or lettuce. What happens is this combination really helps the liver to nourish it and gets the minerals and the glucose it needs. I made sure to have no fat or no protein until noon because that causes the liver to produce bile, and I explained this in more detail in my earlier video, and that takes away from the work of detoxifying and doing all these other wonderful functions that it does to keep us healthy and functioning. Now you might be concerned about eating a lot of fruit. Several studies have shown that fruits are actually good to reduce the risk of type 2 diabetes. A 2013 study published in British Medical Journal concluded that greater consumption of specific whole fruits, particularly blueberries, grapes, and apples, is significantly associated with the lower risk of type 2 diabetes. So again, eating fruits can help. And why does it help? Because the liver is getting the fuel it needs. And once the liver gets the fuel it needs and also can restore its glycogen reserves, it can function properly. So I've been on this eating plan for about a year now, and I eat about 100 to 150 grams of natural sugar from fruits and vegetables. My blood sugar has stayed around mid 90s. In fact, recently I checked, it was 93. So definitely this diet has been good for my blood sugar. And what I've really been also trying to do this whole time is fruits and vegetables from morning till noon, and avoid fats and protein. And again, it doesn't have to always be raw fruits. You can always make steamed potatoes, steamed vegetables. There are all kinds of options you have when it comes to this eating plan. As for the rest of the protocol, you can have a low-fat meal for lunch and a balanced dinner and fruits and vegetables for snacks. So these were the steps I followed. Feel free to modify them any way that works best for you. If lemon water don't work for you, drink plain water. Simple changes can bring great results. You can learn more on how you can restore your liver by reading Skinny Liver or Medical Medium Liver Rescue, and I provided the links in the description below. So you discovered 5 important facts that most doctors do not tell you about diagnosis and treatment of type 2 diabetes. I hope this information was helpful to you, and I will see you in the next video.